Ever wonder how long you will bleed after having your baby? It's a question many expectant mothers have, and it's totally normal to be curious. After all, you're going through a major life event, and your body is going to need some time to recover. The bleeding you experience after delivery is called Lochia. Think of it as your body's way of hitting the reset button after pregnancy. It's a completely natural process that helps your uterus shrink back to its normal size. So, how long will this reset last? Well, it varies from woman to woman, but generally you can expect some bleeding for a few weeks after giving birth. Don't worry, we'll break down the details in a bit. Now let's dive into what Lochia actually is and what you can expect during those first few weeks postpartum. Lochia is a medical term for the vaginal discharge you have after childbirth. It's a mix of blood, mucus, and tissue from your uterus. Basically, it's your body's way of cleaning house after your little one moves out. Lochia changes over time. Think of it like a traffic light: red, then yellow, then white. Well, almost. First, there's Lochia rubra. This is the initial, heavy bleeding, and it's bright red, just like a stop sign. This stage usually lasts for the first few days after delivery. Next comes Lochia serosa. This is a lighter flow, kind of pinkish brown, like when a stoplight is turning from red to yellow. This stage usually kicks in around day 3 or 4 and can last for a couple of weeks. Finally, we have Lochia alba. This is the last stage, and it's a very light discharge, almost white or yellowish white, like a green light signaling you're almost done. This stage can last a few more weeks. Let's talk timelines. Remember, every woman's body is different, so these are just general guidelines. Lochia rubra, the heavy, bright red bleeding, typically lasts for about 3 to 5 days after delivery. Think of it as your body's way of getting the initial cleanup out of the way. Lochia serosa, the lighter, pinkish-brown discharge, usually hangs around for a couple of weeks, often from day 3 or 4 to around day 10. This is when things start to calm down a bit. Finally, Lochia alba, the light, almost white discharge, can linger for a few more weeks, sometimes even up to 6 weeks postpartum. It's like the final sweep after a good cleaning. It's important to note that these are just averages. Some women might experience certain stages for a shorter or longer period, and that's perfectly normal. However, if you're ever concerned about the amount or duration of your Lochia, don't hesitate to reach out to your doctor. Let's be real, ladies. Lochia doesn't exactly smell like roses. It has a distinct, somewhat metallic odor, especially in the beginning. Don't worry, it's completely normal. Think about it. Your body is shedding blood, tissue, and mucus. It's bound to have a bit of an odor. As long as the smell isn't overly foul or accompanied by other concerning symptoms, like itching, burning, or pain, there's no need to panic. However, if you notice a sudden change in the smell of your Lochia, especially if it becomes fishy or foul-smelling, it's crucial to contact your healthcare provider. This could be a sign of an infection. Remember, when it comes to postpartum recovery, it's always better to err on the side of caution and get checked out if you have any concerns. When to worry. We've talked about what's normal with Lochia, but what about when it's not? When should you be concerned? First, if you're soaking through a pad every hour, that's a sign to call your doctor right away. Heavy bleeding, especially with large clots, could mean something is wrong. Second, keep an eye on the color. We talked about the traffic light of Lochia, but if you see bright red bleeding after the first few days, that's not a good sign. It could mean you're overdoing it and need to rest more. Third, if your Lochia starts to smell really bad, like foul or fishy, it could be an infection. Don't wait to call your doctor. Lastly, fever, pain, or feeling unwell are never good signs after childbirth. If you experience any of these along with changes in your Lochia, seek medical attention immediately. Remember, your body is healing, and it's important to listen to it. If something doesn't feel right, don't hesitate to reach out to your healthcare provider. What's in Lochia? We know Lochia isn't the most glamorous topic, but it's important to understand what it's made of. After all, knowledge is power, right? So, what exactly is in this postpartum discharge? Think of it as a cleaning crew for your uterus. It's a mix of blood, mucus, and tissue from the lining of your uterus. In the beginning, when it's bright red, Lochia rubra, it's mostly blood. As your uterus heals, the amount of blood decreases, and the discharge becomes more watery and pinkish-brown, Lochia serosa. Finally, when it's almost white or yellowish-white, Lochia alba, it's mostly white blood cells and mucus, which are helping to clean up the remaining debris. It's all part of the amazing process of your body bouncing back after pregnancy and childbirth. Lochia overstaying its welcome? We've established that Lochia is a normal part of postpartum recovery. But what happens when it seems like it's overstaying its welcome? Several factors can cause Lochia to last longer than expected. One common culprit is retained placental tissue. This means that small pieces of the placenta might still be attached to the uterine wall, preventing it from contracting properly. Another factor is infection. If you develop an infection in your uterus, it can delay healing and prolong Lochia. Other factors include hormonal imbalances, fibroids, and even physical activity. If you're concerned about the duration of your Lochia, it's essential to talk to your doctor. They can determine the underlying cause and recommend the appropriate treatment, which might involve medication, a simple procedure to remove retained tissue, or lifestyle modifications. Staying fresh down there. Dealing with Lochia can be messy and uncomfortable, but there are ways to make it more manageable. Here are some hygienic tips to keep in mind. First and foremost, change your pads frequently. How often depends on your flow, but generally, every 4 to 6 hours is a good rule of thumb. This helps prevent bacterial growth and reduces the risk of infection. Second, choose comfortable, breathable pads specifically designed for postpartum bleeding. Avoid using tampons, as they can introduce bacteria into your vagina, which is more susceptible to infection after childbirth. Third, keep the area clean by showering or bathing daily. Use mild, unscented soap and avoid harsh chemicals or douches, which can disrupt your vagina's natural pH balance. Lastly, pat yourself dry instead of wiping, and consider using a peri bottle filled with warm water to gently cleanse the area after using the toilet. This can be especially soothing if you have stitches. You've got this, Mama. Bringing a new life into the world is a beautiful, transformative experience. But let's be honest, the postpartum period can be messy, overwhelming, and sometimes downright uncomfortable. Remember, you're not alone in this journey. Lochia is a normal part of the postpartum healing process, and it will eventually come to an end. Be patient with your body, listen to its cues, and don't hesitate to reach out for support when you need it. Whether it's your partner, family, friends, or healthcare provider, there are people who care about you and want to help you through this transition. You've got this, Mama. Stay tuned for more. That's a wrap on Lochia. We hope you found this information helpful and informative. Remember, knowledge is power, especially when it comes to your health. Stay tuned for more informative content on all things pregnancy, postpartum, and beyond. We'll be covering a wide range of topics, from breastfeeding and baby care to self-care and mental health. Don't forget to subscribe to our channel and hit the notification bell so you don't miss out on any of our upcoming videos. And as always, if you have any questions or concerns, please don't hesitate to reach out to your healthcare provider.